Professor Pinky Devi will now introduce the speaker and take the session forward. Thank you, ma'am.
Thank you, Khushbu. Good afternoon to all the dignitaries who came from various places, distinguished delegates, and my colleagues. It is my pleasure to introduce the next speaker, the most awaited speaker. And he will be taking a session on technology in simulation for improving healthcare. Mr. Hari Shankar, sir. Mr. Shankar brings a unique blend of technical expertise and strategy management. He currently serves as the head of IT and administration at ERA University, and also head in Criterion Technology Private Limited. With an impressive career of 28 years, Sir has a transformative leaders in the healthcare and education sector. He is widely recognized for strengthening digital infrastructure and driving operational efficiency in institutional growth here at ERA University. Academically, Mr. Shankar has held a postgraduate degree in computer application and an MBA in hospital management. He effectively bridged the gap between technology and practice as a guest faculty member in the Master of Hospital Administration program at ERA University. He has written a comprehensive textbook on health informative system, offering vital guidance on digital transformation to future healthcare leaders. Please join me to welcome Mr. Hari Shankar, sir, with your warm welcome.
Good afternoon, everyone. After speech of my sister Anuja Bhargava, it is very tough to speak any speakers in front of this dais. So, before starting my session, I'll play a video.
We are living in an era where technology, artificial intelligence, machine learning, and advanced tools like ChatGPT, DeepSeek, Canva, Nomad, Gemini, Meta AI, Grok, Perplexity, Adobe Firefly, and many more are shaping the future. In this age of rapid technological advancement, it is important that teaching, training, and healthcare treatment evolve alongside these innovations. Today, technology in healthcare is growing faster than ever before. The use of simulation in nursing education, training, and patient care is at the forefront of this transformation. By integrating cutting-edge technology into these areas, we can enrich knowledge, enhance skills, and, most importantly, reduce medical errors, ultimately improving the quality and safety of healthcare for everyone. In a 2016 study published in British Medical Journal, it was stated that medical errors are the third largest killer in USA. According to WHO, 1 in 10 hospital admissions leads to an adverse event, and 1 in every 300 admissions leads to death. Harvard University has estimated that such incidents result in the loss of 3 million years of healthy life in India every year.
So, as the theme of this conference, clinical excellence by translating theory into mastery and technology. We can all agree that we are living in an era of technology. When theory meets immersive technology, mastery becomes achievable. And when mastery becomes the standard, patient care improves. I think the confidence grows and the quality of care rises. The video just you saw was a little bit awareness about the transformation of technology into the teaching, training and treatment. And you also saw that in US, medical error is the third largest killer. It was published in British Medical Journal. So where even not only the patient, every citizen is documented, there it is the third largest killer after heart and cancer diseases. So what we say about our country? So when we go digitally, hopefully we will improve this thing. Today's topic for this presentation is technology in simulation improves healthcare. Myself Hari Shankar, I am head IT and administration here, and I am named for different other positions also, OSD and some operation head in one of the company. We are displaying our simulation videos, games and IoT devices as well. We manufacture high fidelity mannequins also in very low cost. So thank you, Pinky ma'am, for introducing me. Thank you, Dr. Pisla and the organizing team for giving me a chance to speak among this august audience. I always say, Dr. Anjalakshi is sitting here, that nurses are the heart of the hospital. Nurses are the heart of the hospital. When we name a nurse, that means a care. जब हम नर्स का नाम लेते हैं, that means care is always there. So, and you faculties, you people are making it possible. So I salute the team, and I really have very good position in my heart for the nurses. So let's start with the simulation. I have divided this conversation into three parts. First, what the elite personality says about teaching with the technologies. Teaching with the 3D games, teaching with technology in simulation. Then what is the concept of medical simulation with the relevant video. There is some problem, so I have used some videos to take you to my presentation. Then there is a real time, if I get a time I will go to the real time remote monitoring dashboard, software with artificial intelligence and machine learning, in which auto alert is there, that we are using in ERA. So you have heard about the Edgar Dale cone of experience. It's a learning ladder in which Edgar Dale in 1969 he told that 90% of what we see and what we do is retention in our brain for more. Even 90% retention is there. हमने देखा उसमें आपका पढ़ा 10% रहा, देखा 20% रहा, देखा और हमने सुना वो हमारा 30% रहा. बट जब हमने इसको देखा और हमने उस पर वर्क किया, दैट इज आवर 90% रिटेंशन वी हैव. डूइंग ड्रामेटिक प्रेजेंटेशन, simulating real experience, doing the real thing. So that Edgar Dale in 1969 told, what we are doing now is the simulation with the technology. Then in World Changing Idea Summit in New York on 21st October 2014, the Alfred Spector say about teaching with simulation and games. He said that when we teach our student with the simulation game, 3D games, then the top 2% of a class with a personal tutor. If technology was employed as a customizable tutor. So what the result? That the backbenchers can be among the top 2% if we go with the technology. Now what NEP 2020 and NMC and INC is saying, in NEP 2020 National Education Policy, under the topic technology use and integration, उसमें एक टॉपिक था technology use and integration. NEP 2020 में उन्होंने कहा था, it highlights the use of technologies such as simulation, learning games, augmented reality, virtual reality and teaching and training. Then our National Medical Commission and Indian Nursing Council, they emphasize on competency based medical education, जो डॉक्टर अनुजा मैम बहुत अच्छे से यहाँ पे करा रही हैं, and we are having a faculty training also in this. Then what is simulation? आप पिछले दिन से देख ही रहे हैं what is simulation. It's a small presentation. It's in a video format.
A simulation is a teaching method where learners practice skills, knowledge, or behavior by participating in scenarios that mimic real-life situations. It helps learners address real-world problems and provides opportunities for discussion after the activity.
So, what is the purpose of simulation?
Purpose of simulation. The purpose of simulation is to help students practice decision-making, problem-solving, and human interaction skills in a safe, controlled environment. Through active participation in exercises, games, or role-playing, students achieve cognitive, affective, and psychomotor outcomes. It also gives students a chance to apply what they've learned and see how principles and theories work in real-life situations.
So, how many types of simulation which I have described? One is your mannequin-based simulation, in which we have low-fidelity mannequins, generally basic models used for practicing basic skills like CPR, taking vitals, administrating injections. Then there is a high-fidelity mannequins. Then I have divided into 3D medical games, what we are using in ERA, and then virtual reality and augmented reality. So, in mannequin-based simulation,
Let's see a demo of our mannequin simulator. Sign in. Choose the procedure.
they are the smart
from
mannequins
options.
what we have
For
made, and it is
example,
displayed in
CPR.
outside also. You can go there and see. It is connected with your app.
Connect device to the mannequin. A questionnaire will appear with
After
3
connecting the
options.
questionnaire related to that
Select the appropriate option
procedure
from the
will be
list
appear.
and finish the questionnaire. Perform the CPR procedure on the mannequin. The pressure indicator and the timer are displayed on your device.
You perform on the mannequin, it will be displayed on your tab or mobile, whatever is connected. How much pressure you are putting, whether you are doing right or wrong.
The application will display the result and save this information to your profile.
So it is logged in by the student's name, and it will be displayed on the faculty portal. Like you are having 100 students, so you don't have to put invigilators on that. Directly you log into this app, like student will log in with their app, and the scores will be directly displayed to their faculties. Individual logging for the students. Then there is a high fidelity mannequins. It is also displayed in our nursing college in 7th floor. You can visit there and you can see there. In high fidelity mannequins, we have a scenario based mannequins, in which you can create any scenario, and according to that you want like a respiratory distress is there, or if you want any cardiac arrest, you want to make any scenario regarding cardiac arrest, you can make it, and then you can perform that procedure. And it is also auto evaluation is done.
In high-fidelity mannequins, we provide different scenarios to the mannequin,
same is displayed
where the
at,
same
7th floor
mannequin
there.
can be a 25-year-old male patient or a 60-year-old female patient. The scenarios given to the mannequins are provided by medical professionals as well as live patient data from the ICU, in which the nurses can perform ACLS and BLS skills. The scenarios consist of different questionnaires to test the player's skills, and they need the player to perform different procedures on the mannequin. Nurses can perform skills like checking the blood pressure, giving medicines, performing IV, along with many more on the mannequin. The mannequin also gives feedback of showing pain or wrong input by tears. The application gives a report of the scenario to the player as well as to the organization, so that the progress can be tracked over time.
Here also auto evaluation is there. The scoring will be directly displayed to the faculty. So now there is another type of simulation, that is nursing simulation games. What we have made 3D medical games. So
Another type of simulation is nursing simulation games. These are computer or digital games that let students act as nurses in virtual healthcare settings. Students can practice tasks like checking blood pressure, giving medicines, and handling emergencies. They help improve clinical skills, decision-making, and confidence by allowing students to practice safely and learn from mistakes without harming real patients.
those who are interested, they can come to our lab also. They can log in as a nurse, and they can perform the all the procedures there. So the example, just I will show how it works.
The game is divided into three
This is a
parts:
BP game,
notes,
what
quiz,
I'm
and
going to do.
procedure. Players have to study the notes to unlock quiz and complete the quiz to unlock the procedure. First, you need to put the BP cuff 2.4 centimeters above the cuboidal fossa on the patient. Use a sphygmomanometer and pump the inflation till it reaches to the 200 mark on the meter. Now release the pressure and listen to the sound.
It's not a video. Basically, it's the player is playing this game to how to take a BP. Result appeared. So, good work, doctor. That the answer will be there from the gaming side, and hence the one procedure is completed. Now, their score is also auto-evaluated. It will be displayed on the faculty portal. Then virtual reality. I think augmented reality and virtual reality you must be knowing. Augmented reality is what is displayed, like if we see the man is going on the mountain, and if I want to augment it, the same thing I will augment into different format, means real to imaginary. But when we talk about the virtual reality, all virtual scenario is there and we are working as a real. So for this, I think Vikas, you are in headset, I think give to Rashmi ma'am. See ma'am how to take a pulse with this. So now ma'am is playing this how to take pulse. I'll show you how it is seeing to ma'am in this.
Hi, a 27-year-old female patient is here. Could you please evaluate her pulse rate?
Good morning, Miss Neeti. How are you feeling today?
Morning, doctor. I'm feeling fine, thanks.
That's good to hear. I see from your chart that we're focusing on checking your pulse rate today. Have you noticed anything unusual with your heartbeat recently?
Not really, but I've been curious about it. Sometimes it feels like it's racing a bit, especially after I exercise.
I see. It's normal for your heart rate to increase during exercise as your body requires more oxygen. Do you recall how fast it gets?
Not exactly, but I can feel it pounding sometimes.
Alright.
The exact communication will be there in the all VR set.
Get a better idea. Do you mind if I take your pulse?
Go ahead, doctor.
Well, let's begin with finding the artery.
Sure.
The selection is with that remote the man is having. Yeah.
Now carefully count the pulse
Okay.
and raise your left hand wrist to see the clock.
Okay.
If he does right, he will get that score also.
Great job at counting the pulse.
Okay.
Well done.
Thanks.
So in this way, we can take the pulse. This is a part of simulation for the long-term memory retention. Then there is a real-time remote monitoring dashboard. What we are using in ERA, every equipment which is in ICU are integrated with our softwares. So a small video of this.
Real-time remote patient monitoring. The dashboard lists patients along with their live vitals, namely blood pressure, oxygen saturation, respiratory rate, heart rate, pulse rate, and temperature, and the latest investigative parameters. All these values are color-coded to visually differentiate abnormal parameters. The live patient data is continuously analyzed by the dashboard to sort the most critical patients to the top of the list. AI-powered dashboard. Smart alerts on the dashboard are backed by AI and enabled for drug interactions. Drug interaction can be enabled in the dashboard to notify in case of any interactions between a set of prescribed medicines. Based on the severity of these interactions, they are categorized into mild, moderate, severe, and fatal. Drug contraindications. Drug contraindication
So
can
I'll
be
skip
enabled
this
in the
slide,
dashboard to notify
because
in
we
case of
are
any
running short
interactions
of time.
between.
So in ERA we have developed one portal as a DigiNurse, where all the simulation games and other the softwares what we are using is in a single portal.
ERA has its own website named DigiNurse that contains all the simulations used by various departments, namely Digi Simulator, Mannequin Simulator, Medical VR Game, MedLab, Care, Medico-Skill, and Emergency Doctor.
MedLab is a portal in which all the nursing lectures we have converted into Hindi also because some of the students are from the Hindi background. So that can be displayed while teaching to the student. It's a mix of PowerPoint and animation. We have an integrated lecture also. We can be displaying on our stall where we have put our equipments. Then benefit of simulation, you all know, these are hands-on learning, skill enhancement, bridging theory and practice, mistake-friendly, practice rare procedures, improved retention of information, then improve patient care, of course, and unbiased result. Means it is an unbiased result and real-time feedback. So, develop fine motor skills.
Hello, everyone. Hi, Hari. I think since you were very busy in your son's wedding, you forgot me this time. Anyways, congratulations on your son's wedding.
Thank you, Simu. Earlier, my presentation was always with the Simu, but this time I didn't included her because of my business in some of the work. So, thank you, Simu. So, Simu, let's conclude the session.
By using nursing simulation mannequins, interactive simulation games, 3D animation-based learning, and self-evaluation tools like the CARE program, students gain high-quality training that supports long-term knowledge retention. When combined with AI and machine learning-based monitoring systems and integrated EHR or EMR platforms, these technologies help reduce errors, improve patient safety, and ensure consistent, high-quality medical care.
Okay, thank you, Simu.
Hope you all had a wonderful and enriching session with my dear friend. Thank you all for joining us.
Thank you, Hari sir.
You can scan it, and if you have any questions or related to this, you can just send it to me.
Thank you, sir. Thank you, ma'am. Moving forward, I would like to invite Professor Pinky Devi ma'am to present a token of memento and certificate to Mr. Hari Shankar sir.